Okay, shaving
Okay.
cream, the same as shaving gel.
Okay, great. Welcome everyone. I'd request you to mute
Shaving cream, the
yourself
same as shaving gel. Pero
if
pareho lang silang purpose.
uh, we're
Prevent
starting
powder.
off the webinar. So
Pareho
those of
ano
you who
component.
are unmuted, if you could please mute yourself so we can get the webinar started. Welcome. My name is Mohini Venkatesh, and I'm from Save the Children. Welcome to the May 2019 Fresh School Health and Nutrition webinar. A bit about the Fresh webinars. These are a series of monthly presentations on school health and nutrition from low and middle income locations, jointly organized by the Fresh partners. This month, we are commemorating Menstrual Hygiene Day, which takes place on the 28th of May globally. The theme for this year's Menstrual Hygiene Day is It's Time for Action. And to learn about the action taking place in countries, we have invited colleagues from as far apart as the Philippines and Mexico to come share their experiences. Now to introducing our speakers. From the Philippines, we have Dr. Maria Corazon Dumlao, who is the Chief of the Bureau of Learning Support Services, School Health and Nutrition Division at the Department of Education in the Philippines. Dr. Dumlao has almost 27 years of experience working in this area, and besides being a medical doctor, Dr. Dumlao also has a degree in biology and nursing, a diploma in biomedical and health informatics. She is a master trainer in public health and also a global trainer on the universal prevention of substance abuse. Currently also appointed as the governing board member of CIMEO, the Southeast Asia Ministries of Education Organization, Regional Food and Nutrition Group. Dr. Dumlao, welcome, and thank you for representing the Philippines and the Learning Support Services. Also, Dr. Ella, who couldn't join us today, and a shout out for our colleague from the Philippines, John Valdez, who is joining you from Manila. From Mexico, we have Sofia Garza, who is a major in international relations and has been with Save the Children Mexico since 2017, initially working in global platforms for disaster risk reduction and also working on toy libraries as a community strategy for reduction of violence. She's currently an operations leader of the hashtag We See Equal project that aims to improve gender norms and increase knowledge about puberty. With Sophia representing Mexico is Jeannie Long, who is the Director of School Health and Nutrition in the Department of Education and Child Protection at Save the Children. Jeannie provides technical assistance on school health in several countries, including El Salvador, Guatemala, Mexico, and Thailand, and looks at issues around water sanitation hygiene, menstrual hygiene management, puberty, obesity, and road safety. Jeannie has a master's in public health from the Rollins School of Public Health at Emory. Welcome, Sophia and Jeannie. I'm going to now hand it over to our presenters, starting with Dr. Dumlao. And before I do so, a quick reminder to keep yourselves muted through the presentations. And if you have any questions during the talks, please feel free to type them into the chat box. We'll take your questions at the end of the presentations. Thank you very much. Over to you, Dr. Dumlao. John, you'll have to unmute yourself. Can you? Can you tell me? Yeah.
Okay. The programs and interventions of the Department of Education and its stakeholders are anchored on the provisions of the United Nations Convention on the Rights of the Child. Every child has the inherent right to life and access to proper health and nutrition, health education, and proper hygiene and environmental sanitation. Next slide. The Department of Education Order Number 10, entitled Policy and Guidelines for the Comprehensive Water, Sanitation, and Hygiene in Schools program, has the following objectives. That is to ensure correct knowledge and understanding among learners of the effective hygiene and sanitation projects, to improve equitable access to safe water, adequate toilets, and hand washing facilities, to improve hygiene and sanitation practices among the learners, to enable them to develop lifelong positive hygiene and sanitation behaviors, to ensure that schools are kept clean and safe through school-based solid waste management, proper drainage, elimination of breeding grounds for mosquitoes to prevent vector-borne diseases, and also to strengthen food safety. And lastly, to engage public and private partners for program implementation and sustainability. Now let's look into the WINS program steering. In order to implement the WINS policy and programs, the Department of Education and a range of stakeholders, both internal and external, work together with specific roles and responsibilities for formulation of policies and guidelines, standard setting, technical assistance, quality assurance, program management, and implementation. So at the national level, we have the Bureau of Learner Support Services, the School Health Division, which is the leading unit in the department with the responsibility of developing policies and national guidelines and scale-up strategies, responsible for programming, budgeting, capacity building, policy monitoring, linkages, and donor coordination. At the regional office level, they have the responsibility of program management, quality assurance, regional monitoring and evaluation of schools division offices, provision of technical assistance to schools division offices and the WINS policy and program. That includes also capacity building to SDOs, partnerships, and implementation of the recognition system for SDOs in schools based on their performance on WINS. It's very important to note that the national and sub-national regional level have a strong collaboration between national government agencies, the WINS Technical Working Group, and other development partners. Now let's look at the schools division offices, and that includes your provinces and municipalities. They have the responsibility of program management and monitoring of school level WINS implementation, including the provision of technical assistance to schools, partnerships, linkages, and most importantly, the implementation of the recognition system for SDOs and schools, based of course on their performance on WINS level of improvement at the 3-star practice. Now the school level, that's the grassroots level, they have the responsibility of participation in the WINS assessment and monitoring to generate the WINS school data. They are responsible for program implementation, self-monitoring, and continuous improvement through the adoption of the 3-star approach. They're also expected to strengthen partnerships and linkages with other partners and also to involve the community. It's also important to note that at the local level, there's a very strong collaboration between local government units, non-government organizations, and civil society organizations. Next slide. Now let's look into the WINS support system. We have the monitoring and evaluation system, which covers processes, ensuring quality of implementation, progress, reflecting implementation outputs and results. We also have the recognition system following the three-star approach as a means to ensure that standards are followed by, of course, motivating and recognizing school compliance and performance. This system involves two levels, the schools division level and the school level. We also have the learning mechanism to capacitate the focal persons on the DepEd processes and standards related to WINS. We also have the resource mobilization mechanism, which includes the processes for resource generation and fund allocation. And a very important component is the application of school-based management principles and mechanisms such as school improvement planning and continuous improvement. So WINS is already integrated in the school improvement plan. Next slide. The WINS three-star approach is an integrated system. So as it involves quality assurance mechanism, and all schools are mandated to monitor their WINS implementation to ensure that the enablers for learning are in place and functional. As a monitoring scheme, it shall support the gathering of information and evidence for other relevant management systems such as, of course, planning and budgeting, programming for continuous improvement, compliance reporting to quality standards, and performance management. As a monitoring scheme, the data integrity shall be given premium. Thus, the validation of information is a prerequisite for awarding performance. The monitoring reports of schools shall serve as basis for technical assistance of the school's division offices. We also have the recognition system, and the department shall give premium to both the effort of the school community to improve and the results of the efforts themselves. Let's look into the three-star approach adaptation in the Department of Education. Building on the WINS policy, DepEd adopted the global three-star approach as a template or guide to implementation. The WINS policy and guidelines was translated into standard rubrics form for the three levels of school implementation. Standards were also developed for FDO program management level. Now, a WINS monitoring form was developed both for schools and the FDOs, and that form consists of 56 questions to measure 40 indicators, which is being filled up by the school and community. The FDO WINS monitoring form consists of 12 organization enablers with 23 questions or means of verification that comprise half of the FDO score. And half of their score comes from the status of implementation or the performance of their schools meeting the three-star and those who improve. Let's look into the MHM related data that are being collected. Now, from the WINS monitoring form and three-star indicators, there are actually 5 non-negotiable crucial indicators that schools need to comply for them to be awarded a star level. These crucial indicators include safe drinking water, gender segregated toilets, group hand washing facility with soap, daily group hand washing activity, and access to sanitary pads. It should be noted that access to sanitary pads is a non-negotiable indicator for the WASH in schools. What are the MHM related data being collected? Our WINS indicators that enables MHM in schools are being collected and monitored include, number 1, regular supply of soap and water in individual hand washing stations near toilets, disposal of MHM materials, private, secure, functional, gender segregated toilets, rest space for MHM, and availability of IEC materials on menstrual health management. Now, how are WINS, including MHM data, being collected? So all FDOs and schools, both elementary and secondary, were oriented on the WINS online monitoring system. The national level downloaded funds to ensure that the focal persons for WINS are capacitated. So the process starts with the schools conducting orientation on the WINS policy and the WINS monitoring, and they then conduct self-assessment using the form. There is a printed version of the form that the members of the WINS PWG can fill up. And there's also a Microsoft Excel version of the monitoring form where they can transfer their assessment or use directly. Now, the Excel file, once completed, will auto-generate results of their WINS assessment, the 3-star rating of school per WINS theme or sub-theme of water, sanitation, hygiene, deworming, health education, and graphical presentation. Color coding is as follows. For 0-star, it's coded red, 1-star is coded yellow, 2-star green, and 3-star blue. The star level is calculated based on aggregated scores, taking note that if the 5 crucial indicators are not met, the school will automatically generate a 0-star ranking regardless of the other indicators met. The WINS monitoring form should then be uploaded to the WINS online monitoring system. And the data generated will be utilized at various levels. Where are we now when it comes to MHM-related indicators? Since the WINS policy was issued in 2016, 2 rounds of WINS monitoring have been conducted. And initial results from the school year 2018-2019 monitoring data, however, data collection is still ongoing, already shows improvements in the following MHM indicator. So for example, on the indicator, all functional toilets are secure, private, and have door with lock. So for elementary schools, there is already a significant improvement from 79.8 to 85.6%. For secondary schools, from 84.2 to 88.4. And that also applies to all the other indicators. Where are we now on MHM-related indicators? Let's look at the timeline for WINS implementation and monitoring based on DepEd Order or DepEd Memo 194 series of 2018. FDO to ensure all schools updating their WINS status by uploading their school information annually within the month of November, and this should be signed by the SDS, or Schools Division Superintendent, or school health personnel prior to encoding in the WINS online monitoring system. Now, FDOs should submit the validated WINS report by the end of January of the following year, and the WINS data generated will then be utilized at various levels. Of course, it depends on the level of governance. At the school level, it's for review and updating of their school improvement plans. At the FDO, it is used for technical assistance planning to schools and recognition of schools with improvement. And at the regional offices, it's also for technical assistance planning to FDOs and recognition of schools division offices. So on rewards, what is being recognized? There are various levels of recognition depending on the improvements or levels of practice made of schools and schools division offices. Say, for example, at the school level, we give or we award a citation of appreciation, and this is given to schools who have elevated the implementation to a higher level. For improving, the school will be given a citation of appreciation assigned by the school's division superintendent. The recognition award is given to reach the desired advanced level of this implementation or 3-star. Excellence is awarded to successfully maintain an advanced level of implementation. So this also applies to division offices. We also provide citation of appreciation for the divisions have improved in the level of this implementation, or they have moved to a higher level of implementation from the previous year, and the citation of appreciation shall be signed by the regional director. And there's also the recognition award, which is given to the FDOs for achieving the indicators on outstanding management and technical assistance to schools, and the result of which is the school's observance of WIN's national guidelines. So this translates to a rate to reaching a 3-star level of WIN's program management. The Seal of Excellence is awarded to a school's division office for having successfully maintained a 3-star level of WIN's program management over a period of 3 straight years. What is important is that we recognize not only the results, but also the efforts poured by the school stakeholders to ensure that there is an improvement in the implementation of WINS in the school. For more information about washing schools and the 3-star approach, you can look at all of these materials, the debit order. We have also developed a 6-page brochure on the overview of all 3-star approach, and also the brochure for water, sanitation, deworming, and health education, and hygiene. So these 5 booklets are available, and they provide us with detailed and practical information on how to get active and improve the STAR level. Thank you very much for this opportunity to present our initiative in the Department of Education together with our stakeholders.
Thank you so much, Dr. Dumlao, and I'm sure there'll be questions about this system of ensuring standards and monitoring and appreciation. So we'll take those questions later, but we'll move over to the Philippines, to Mexico now to hear from Sophia and Jeannie.
Thank you, Mohini, and thank you again for joining us today. Jeannie and I are going to present to you our puberty and gender equality project that is being implemented in Mexico. The next slide, please. This is just a quick overview of the agenda. I'll give you a brief background as to why we decided to implement this project, and then we'll go right into describing We See Equal and the CHOICES curricula and share some of our results and learnings. The next slide, this data revealed the need to implement a gender and puberty project in Mexico. We recognize that in Latin America and in Mexico, we have some of the highest rates of gender-based violence. We've seen that 44% of women have reported being a victim of violence. And we also identified that there's a strong link between the situation we live in now and gender norms that are learned and reinforced at a very young age. So this is part of the reason we wanted to adopt CHOICES for Mexico. Next slide, please. In a very broad sense that will be detailed a bit later, our project is based on the implementation of a gender and puberty curricula. The first version of this curricula, named CHOICES, was developed in Nepal and focused only on improving gender norms. An evaluation revealed that children who participated in the program had improved attitudes and practices related to discrimination, violence, and showed an overall less rigidity towards gender norms. And in Mexico, we decided to integrate the topic of puberty into this curricula since we recognize that it is closely related to gender, the social construction of gender norms that lead either to gender violence or gender equality is a key concept within sexuality education. Next slide, please. Once we adapted choices to Mexico's context, we defined not only our main objectives, but also how we were going to achieve our results. And our main program activities consist on, firstly, we directed a formative assessment to adapt choices on puberty materials to Mexico's context. And also we did Save the Children Mexico staff training on these two specific topics. Once that formative assessment and adaptation were concluded, each semester of implementation consists on 3 5-hour teacher training sessions on how to implement choices in their classrooms, the establishment of child-led equality clubs as a community mobilization strategy in each school we work in. And at the same time, throughout the implementation, we conduct a lot of monitoring activities like classroom observations and a CAP survey. And the results of this CAP survey will be discussed later. Next slide, please. The project operates in 4 states, which are Mexico City, Puebla, Hidalgo, and Yucatan, and we are expected to train 400 teachers and reach 10,000 children. And halfway through our project, we've reached about 6,000 children and 200 teachers. On the next slide, essentially the formative assessment took almost a whole year, which was 2018. Our work from February to August translated into an adapted curricula that was implemented during the second semester of that same year. We implemented the project as if it was a real thing, but we really treated it as a pilot, meaning we were open to making modifications not only to choices itself, but also to monitoring tools and teacher training content, among other things. So by 2019, we reviewed all lessons learned from this previous semester and concluded choices adaptation. We are now currently implementing this final version of choices in the 4 states that I mentioned. It is important to know that we recruit new schools each semester, even though some strategies like the equality groups are designed to be an annual and continuous activity. We do encourage schools to direct the already established equality groups once our semester of direct implementation ends. So the next slide describes our formative assessment. These 5 themes were the most mentioned by children, and choices is built upon these 5 topics. So respect, equality, life plan, violence, and puberty. Some of these topics were expected to come up during group discussions with children, but respect was definitely one of the most both interesting and challenging topics. Although girls and boys appear to believe that men and women are equal, by digging a little deeper, we identified that they still harbor harmful gender norms or admitted that situations at home or at school were not completely equal. So it's as if children knew the correct answer when asked if boys and girls were equal, but a more advanced discussion gave us more clarity on how teasing, bullying, or discrimination practices are still common, but in more subtle ways. The next slide is an overview of the choices curricula. It comprises 11 sessions meant to be implemented during class in 1 semester. They're divided into 3 thematic blocks that also correspond to each teacher's training session. And as you can see, we developed 2 different versions. During our formative assessment, we saw that Yucatan had more rigid and traditional gender norms. So the difference between these 2 versions is that each one has 1 session that the other doesn't. And these different sessions are the ones that have a star on it for you to identify them. But as for the other sessions, there are no changes in the sessions that are on both versions. For the purposes of today's webinar, we're going to go over the first 3 sessions. Session 4, Who is Who, gives that leap of identifying the difference between sex and gender. while sessions 1 through 3 focus only on puberty. So the next slide is the description of the first session. Getting to know puberty allows children to be able to identify physical and emotional changes related to puberty. During this session, the class is divided into teams, and each one gets to read a situation in which a character is going through some changes. Teachers then facilitate discussions, and kids have the opportunity to talk about what was happening in each example. Once each team has shared their ideas, they write all these changes in a poster, which is in the image in the next slide. As you can see, the poster has blank spaces and the images cue what change it refers to. So in the next slide, you have the examples of how teachers write the correct answers. So for example, there are mood swings, and for girls, we identify that their period starts and the hips start to widen and so on. The second session goes deeper on processes of menstruation and ejaculation. The activity consists on answering a true or false quiz in group. The classroom is divided into two, and children answer each question by moving to the left if the statement is false, or to the right if it's true. So the quiz is poster size, and the teacher marks each correct answer as children answer it. Just to give a quick example, because I'm not sure if you get to see the quiz clearly. One question is, girls are always in a bad mood when they're on their period, true or false, and sperm is produced in the penis, true or false. The next visual materials on the next slide are reviewed during the session, and teachers are encouraged to post them in the classroom walls and use them as a complementary material when they review any other topic related to puberty during the school year. This last session in the next slide allows children to identify hygiene habits that are necessary to practice during puberty. The activity is similar to the previous session. Children are handed out a crossword. It's a big one, so it's one for the whole group. And each word is related to a hygiene practice. So for example, quote, "It is important to wash blank to avoid acne and breakouts," end of quote, and the answer is face. And quote, "During the period, girls use hygiene products to manage their blank," end of quotation, and the answer is menstruation. And then the session is followed up by a second activity that consists on calculating the menstrual cycle, and a calendar is handed out individually to each boy and girl. So the teacher gives out a date, and children count days until the next menstruation and the ovulation cycle too. The next slide is the example of the materials I just mentioned. And this is all from me. I am now handing out the presentation to Jeannie.
Hi, everyone. Can you move to the next slide, please? Thank you. So this is just providing you an overview of how we sampled children for our CAP survey and for a quiz. And so basically, we've collected a ton of data here. And we had over 2,000 children who were eligible to take the survey. Of those whose parents consented to have them participate in the survey, all of them took a puberty quiz, which was 29 questions. And then we took a sample of those children that took a full gender and puberty CAP survey. And as you can see, it's important to note the numbers on the right, that we oversampled for girls because essentially we wanted to collect more specific information on menstruation and girls' experiences in schools. But if you look at this, the green box, which is the menstruation-related school participation, stress, and self-efficacy survey, at baseline, we only had 48 girls who had experienced having a period in school. And so at Endline, that increased, but essentially the results that I'm going to talk about, I'm going to summarize pieces of each of these pieces of our assessment at baseline and Endline. Next slide, please. Our CAP included several different concepts that we were measuring, and I'm going to talk about only the ones related to MHM and puberty for today. Otherwise, we'd need a whole nother webinar to talk about the gender aspects of the survey. But we are going to present on the puberty quiz, which is the 29 true or false questions, and then some basic puberty and menstruation awareness questions, as well as a subset of our participation and stress items. Next, please. Next slide, sorry. So what I wanted to show here, oops, can you move up one more? Sorry, Maria, thank you. This is from the CAP survey. So this is basically talking about menstruation and puberty awareness at baseline and endline. And what is important to note here are two things. First, that at baseline, you can see that knowledge of menstruation is relatively high for girls. About 86% of girls knew of menstruation, whereas only 55% of boys did. But in reverse, we see that boys were more knowledgeable or had heard of puberty, more boys had heard of puberty than girls had. And likely what this insinuates is just that when anyone are talking to girls about puberty, it's usually about periods, and boys more about puberty. But we did see significant increases at endline, just of the recognition of the topic. And then I think really important, though it may not sound that interesting, is really important for our project to see that there was a 30% increase in children who reported learning about puberty in school, which just means that our teachers are teaching the material in class. And since Sophia mentioned that we do monitor some of our classes, but we can't be there for all of them, it was important to see this check in place. Next slide, please. This goes over the average puberty scores of those 29 questions. You can see that at baseline, kids were averaging about 47% correct in their questions, and at endline it was 60. Now, that would still not be a great score, a great test score in school, but it is a significant increase, and we are hoping that since this is the pilot data, hopefully we'll see increases in the next assessment, but there was a 13% increase. Next slide. I also wanted to highlight a couple of things that I thought were particularly interesting. In Mexico City, Puebla, and Merida are where these assessments are taking place, are cities in their urban centers. And so you still see, even at baseline, that only 57% of girls believed that it was safe to bathe during their period. And that increased to 72%. But some of these myths that we think about for menstruation, they exist even in these very urban settings. We also saw that there were key messages in the puberty materials that kids were understanding and grasping. For example, that girls knew that the changes that they were experiencing weren't going to be the same for every girl. They weren't going to happen in the same order or in the same sequence, but we saw that increase from 36% to 55%. And as well, like all girls and boys understood that puberty is not just a physical change, but also a social and emotional change. Next slide. Here, there are a couple of things that we were really glad to see. And the first is that on the top bar, this 18.5%, the girls who know what to do when their period comes, that represents the girls who had not yet had their period, but did know what menstruation was. And what we see is that between baseline and endline, 18% of girls, there was an increase in the number of girls that knew what to do when their period would come. And that's exactly what the purpose of our puberty materials was to teach girls what to expect and how to manage their period before it comes, so that it's not a surprise and so there's not so much anxiety around it. If you skip down to the bottom, what you're seeing are kind of the number of girls who have reached menarche of that 356 girls. And then the next slide, sorry, not the next slide, but the two bars above it are showing those who have had their period at school and those who knew what to do when they had their first period. And so if you look at this, girls who have reached menarche, that's 74, and the girls who knew what to do at their first period, there were actually a large percentage of girls who, when they had their period, weren't sure how to manage it. and we've seen that decline. Next slide, please. So this table is just a subset, a really small subset of the items that we have in our menstruation-related school participation, stress, and self-efficacy survey. And I'm only showing some because, again, this is a very large survey, and we had a very small amount of girls who could take this section of the survey. But we are focusing on and examining some of the trends we see here. And so if you move to the next slide, even though the purpose of this first section, which is participation, the participation measures are aiming to look beyond attendance for how girls are, but really looking at how girls engage in school and how their participation in school may be affected by having their period. And so while the focus isn't on absenteeism, we did see that there was a reduction in the number of girls who missed a day of school from 29 to 20% of girls who had their period in school, and that we saw fewer girls wanting to leave school to change their sanitary napkin, and 15% fewer girls reporting experiencing any kind of difficulty paying attention in class because they were worried about their period. So we were excited to see those reductions. Next slide. In the stress construct, we were kind of looking at typical emotions that girls may or may not feel in school during their period. And what we saw here were reductions in kind of worrying about other girls gossiping about them. We saw fewer girls worried about using the school bathroom or disposing of their sanitary pads on the days they had their period, which again is another topic that's discussed in kind of the MHM lesson. And, you know, we do hope to see this improve as our school equality clubs and the school administration start to work through establishing better policies and more sensitization of the topic of MHM. Next slide. There were, you know, not all of the items in our survey increased or decreased the way that we wanted to, and this is just an example. I think this stress item, the last time you had your period in school, did you worry about, were you afraid boy classmates would make fun of you? And we really hoped that with the inclusion of choices and puberty together and this creation of empathy, that we would see less teasing or around menstruation. And the truth is that we don't know if teasing is still there or if girls are still just worried about it because of the nature of, you know, how old they are and what's happening in their lives. But there are things that we hope to see improve later, but this is just an example of not everything was perfect and not everything showed up the way we wanted it to. And then finally on the bottom there, you see that while even though we had a very, very small sample of girls who could take the survey, we did see that girls, for every 10% of participation in school that we saw through these items, basically the more girls participated, the less stress they demonstrated, and through this survey, and there was a 4% higher self-efficacy score. So basically, even with this small subset, we were seeing that the items and constructs we were interested in are interacting the way we expected. Next slide. Finally, we did find some statistical significant correlations between gender, puberty, and MHM, even with our small sample. We can't speak to what caused these relationships or why these relationships exist, but we were interested to see them, and it made sense from a theoretical standpoint. For example, what we see is that among children who took the puberty quiz and the CAP, we were able to actually link their data. So we took the puberty quizzes that were on paper and we linked them to the children who had taken the CAP. And what we saw was that for every 10% increase in gender positive attitudes, children were more likely to score a 0.5 point higher on the puberty quiz, which again is showing there is some relationship that exists between gender and puberty. And that children with more positive gender norms at baseline also were more likely to know about puberty and menstruation. Again, we don't know why this happens or who is responsible, if it means that parents are talking about it in the home, or what that is, but it does make sense theoretically that these relationships exist. And I'm going to hand it back to Sophia.
Thank you, Jeannie. So given that this methodology of training teachers may be new to some of you as it was for us, we wanted to share some of our experiences working directly with groups of teachers. So as you can see in this slide, we identify two levels of analysis or approaches. The first one is related to being able to reach agreements with each state secretary of education and each individual school to ensure we'll be able to implement the project freely. For example, if we set a date for a training session, we expect teachers to attend it, and that necessarily is achieved through establishing good communication channels with the Secretary of Education. And the formative assessment is important not only to adapt the content, but also to identify preconceived notions of these topics in order to know which approach to take when discussing our project with school authorities. And also as a way to convince schools and the secretary to implement the project is ensuring that the content aligns with the already existing study plans. In the case of Mexico, there is an ongoing education reform, and we had to study it very thoroughly to prove that we were not proposing something completely divergent from what the reform entails. And as for the second level of analysis, it relates to choices implementation strategy. We've experienced low levels of commitment from some teachers, and we are focusing on developing all necessary incentives for them to be interested and invested in this project. I think our main goal is for our project to be seen as a professional training and not just an extra obligatory course. So handing out the final printed version of Choices is one of the many examples of how to ensure teachers perceive our project and the training sessions as professional and time-worthy. Since we're not able to observe each individual session, we are counting on teachers to give us all necessary information to monitor and evaluate the project. We developed a brief and simple questionnaire for them to fill out each time they implement a session. So that way we know if they're even implementing in the first place. And we also try to communicate to them the importance of sharing their insight for us to strengthen our project. And they also share experiences of implementation during the training sessions, so their insight is social. The last one, as I mentioned before, there may be some discomfort or resistance against the topics of puberty and gender. So here, staff training is key. We focus on increasing their technical knowledge and of gender specifically, and our plan is to be able to conduct a staff training session after each semester of implementation. That can take up, that takes about a week. And our team has also received training on the CAP survey, how to approach boys and girls and how to use tools such as Kobo and so on. And lastly, using data may help convince teachers of the relevance of talking about these topics, although we do not encourage them to share this data with children. During our sessions, we illustrate some situations by giving some indicators such as domestic violence rates or women in science, and that really help them to dimension the scope of our project and these topics. But this data is definitely not intended to reach children. That is all from me and Jeannie. Thank you very much for your time.
Thank you so much, Sophia and Jeannie, for your presentation and very interesting findings, and great to hear about the strategies you're employing to address multiple related issues around puberty, gender, violence, and yeah, at a critical age in children's lives. So thank you for that. I'd like us to use the last 10 minutes of the webinar to ask questions and for our presenters to answer them. There was a question from Selvin to the colleagues from the Philippines about how involved or how integrated the the menstrual hygiene monitoring work, or Washington Schools monitoring broadly, is with the Department of Health, and how they're working with the Department of Education. Dr. Dumlao, if you can take that question. John, we'll need unmute. Let's see.
Can you hear us now?
Yes, we can hear you now.
As to the relationship with the Department of Health, there is a strong collaboration of the Department of Education with that of DOH on school health and nutrition programs at the national level. The DOH focal persons and key school health and nutrition technical people are involved in policy formulation, standard setting. And we all know that at the grassroots level, the DOH is devolved so that the local government units program on adolescent reproductive health services and adolescent nutrition programs complement our DepEd programs. Although we have separate monitoring tools in the department because of the target population that we are catering. Of course, we cater to kinder to grade 6. In the Department of Health cater for children below 5 years old, and also for adults. Any provision of health and nutrition services, of course, will complement our efforts. So it's more of a complementation and data sharing, as well as provision of technical expertise when it comes to policy formulation.
Great, great. Thank you so much. And there was another question, this was from me, around what you're seeing in the findings so far, as to what are some of the areas that schools are doing really well in meeting the stars, and which areas of MHM do they need to do more from those 5 or so dimensions that you're looking at for menstrual hygiene. If you could just tell us briefly, and then we'll take the questions for Mexico.
Okay. The areas needing improvement when it comes to MHM includes the availability of menstrual hygiene friendly toilets. You can see in the 2 rounds of WINS monitoring that has been conducted that for the all-inclusive female toilets which have wrapping materials and trash bins for use sanitary pads, this is an area that needs improvement. If you also look at the availability of IEC materials and menstrual health for teachers and students, is also an area we need to improve at. And also the availability of rest space for girls with menstrual discomfort.
Right. Okay. Thank you. Thank you for that. Now moving to Mexico, and there were a few questions, and maybe you want to take them together. So there was the question around measurement, and what would you recommend as a minimum requirement for projects if it needs to be done at scale? What would the basic minimum measurement approach be? And then in terms of implementation and all of the great activities you have, how in terms of engagement of students and the duration of the sessions, if you could elaborate a little bit more. And then there was a question around comprehensive sexuality education and how this is different to that. I know you've answered that in the chat box as well, but if you'd like to say more, Jeannie or Sophia.
Sure. I'll talk really briefly about the measurement, and then I'll hand it to Sophia. Just to say that I think if I I mentioned in the chat that if we were to do this again, we'd probably not do 1,700 quizzes, just the sheer quantity of data. It was a lot, but I think, and perhaps we wouldn't ask so many of the menstruation related questions just because at that age there are fewer girls menstruating. But to say that the process for it's the harder and more labor intensive process is developing the survey itself, because in contexts where this isn't a context where people don't send their girls to school, or where they marry their children off at age 14. So questions that are like, do you believe that girls should go to school or should be able to study, engineering? Those kinds of questions are always going to get the correct answer. And so it was actually more the development of the survey that took a long time. And once we had it done correctly, it wasn't, it's not as difficult to apply. It's just the getting questions that make sense for the context was really challenging. But I think we could reduce the scale if it were just a question of monitoring. In this instance, we wanted to make sure that our materials were actually making changes in kids' attitudes, and so we had to measure that correctly. I'll hand over to Sophia about the implementation.
To the question related to how much time does it take to implement the session. So each session in Choices is constructed with different types of activities. You have the central activities, which is the ones that I described that can take up 30 to 40 minutes. But we also encourage teachers to use, it takes about an hour to include all different activities of group discussion and also some activities of integration between boys and girls. And taking over the last question of the comprehensive sexual education, as Jeannie said, given that we're working with 5th and 6th grade, we don't talk specifically about sexual education, rather we focus on puberty. We do mention pregnancy, but it's only seen as a physical and like probable change due to puberty, but we don't go right into sexual education itself. It's more based on gender norms, and the idea of the whole name of Choices is showing them that they have the choice to challenge these gender norms for them to be able to develop and achieve their life plans.
Great, thank you so much, Sophia and Jeannie. And we're almost coming to the end of our webinar, and there's some more comments in the chat box. And what we've seen from today's webinar, I guess, is just a flavor of how menstrual hygiene management interventions can be integrated within different education, health, or other programming in countries. Depends very much on the context in which we're working in. The fundamentals are the same. You want kids to be aware of their changing bodies, equipped with the right kind of information so they can make the right choices and be safe and healthy. There are lots of resources out there which my colleagues and the larger community of practice can point you towards. Do look out for the recording from today's webinar and the PowerPoint. It'll be up on the Fresh Partners site, the Save the Children Resource Center, and UNESCO's HIV and Health Clearinghouse. I'll share the links with you in the chat box. And just to announce that the next webinar, Fresh webinar, is a month from now on the I believe it's the 17th of June. I'll have to confirm that, but it will be in the middle of the month, and we'll be listening to colleagues from UNODC talk about substance abuse prevention. So do look out for the invite for that as well. Thank you so very much for joining. Really appreciate our presenters who've woken up very early and stayed up so late to share their experiences and knowledge with all of us. Thank you so very much and have a good day.